Right now, I want to take a current look at the current COVID situation in Colorado. The 7-day testing positivity rate still high at 27%, but it's been dropping a bit. And some more ICU beds have opened up today, and Colorado hospitals now up to nearly 130 available. Sadly, 11,086 people have died due to COVID in the state of Colorado. And the latest crisis to impact the fight against COVID is healthcare workers getting the virus and not being able to work. CBS 4's Jamie Leary live tonight. And Jamie, a healthcare worker shortage just as we're seeing more patients. That's a tough one.
It is a tough one, Jim. And right now, hospitals and emergency rooms aren't at the point where they have to decide who gets a ventilator and who doesn't. But emergency room physicians and other frontline healthcare staff are at a breaking point and are asking the state to help immediately. Now, right now, about 92% of our acute care hospital beds are in use across the state. Well, the number is dropping. That's much higher than this time last year, and that's been pretty steady for about the last month. A letter to the state from the American College of Emergency Physicians says the nursing shortage across the metro area has cut the number of beds available, and rural hospitals are filling up due to lack of EMS staff to transfer patients to higher levels of care. Essential emergency department staff now have different return to work guidelines when they get sick. Many are being asked to come back to work 24 hours after a positive COVID diagnosis if they have no symptoms in order to provide proper care and keep up with the number of patients.
We still have a couple more weeks at least of very high case rates and associated hospital utilization. And you got to remember, this is a time of year when we typically have people seeking healthcare at high rates, even without the pandemic being present. And so people still have heart attacks, strokes, high acuity medical conditions that need to be addressed. And we want to continue to provide those services. And we think there's some potential ways in which we can work with the governor's office.
The American College of Emergency Physicians is working with the state as we speak on a couple of top priorities. One of the priorities is communicating with the public when to seek emergency care and when not to, and what resources are available. Another big priority is communicating bed availability across the state and how to do that to make sure that patients in rural areas have access to top-of-the-line health care here in the metro area and that they can actually get here. So we're going to continue to keep our eye on this. Reporting live in Denver, Jamie Leary, covering Colorado First.